Hey guys, in today's video I'm going to talk about complications of ulcer. So in previous video I have talked detail in about what is a peptic ulcer, the two types, duodenal and stomach. Then we have learned about the treatment plan of the both. So now let's focus on the complication of ulcer. So first, there is a difference between ulcer and erosion. Erosion is quite superficial compared to ulcer. So erosion doesn't cross the basement membrane. It's just the loss of superficial epithelium. So just epithelium lining is lost. There is no loss of basement membrane. So erosion doesn't cross the basement membrane, while ulcers are very deep. They are muscle deep and they heal with fibrosis. So this we have to remember that ulcers heal with fibrosis. And if they heal with fibrosis, there will be structural anatomical distortion happening in the stomach. So there is mainly this three shapes that are seen. Teapot stomach, that is ulcer at lesser curvature. So the stomach will look like a teapot. Hourglass stomach, when saddle shaped ulcer will happen, and gastric outlet obstruction if the ulcer is at the first part of duodenum more than pyloric canal. So this we have to learn that gastric outlet obstruction, the more common one is first part of duodenum than the pyloric canal. Okay, so if you want to see this teapot and hourglass stomach, then I can show you. So teapot versus hourglass stomach. Okay, so here you can see that the teapot deformity and the hourglass. So saddle shaped ulcer will lead to hourglass deformity. Here you can see. Both are at the lesser curvature only. Now the first complication is perforation. Perforation will lead to peritonitis. So the patient will present as a pain that is sudden, diffuse and severe. After 4 to 6 hours, pain and features of peritonitis will be there due to dilution by peritoneal fluid. So the feature will be decreased. Now what is a guarding? Guarding is voluntary while rigidity is involuntary muscle spasm due to peritoneal inflammation. Rebound tenderness and tenderness. Tenderness happen when we are palpating. So when you palpate, so you put your hand on the abdomen. If then a pain sensation will happen, it is called as tenderness while you put and then you lift your hand. Due to the peritoneal vibration, if the pain happen, it is called as rebound tenderness, also known as Bloomberg sign. So tenderness and rebound tenderness both are features of peritonitis due to the inflamed peritoneum. And guarding and rigidity is also the feature. Now there is pain on coughing also. and not able to pass the flatus or gaze, so vowel sound will be absent, vowel sound will be absent. Now investigation. So gold standard is CT scan because it is pneumoperitoneum. We have to detect the air in the peritoneal cavity. So gold standard will be CT scan to detect any amount of air. Because we know that for air and bone cortex it is the best test. Now investigation of choice is X-ray chest erect view. For that minimum of 1 ml air should be there, air below the diaphragm. Now abdominal X-ray, left lateral decubitus view, for that minimum of 2 ml. So investigation of choice is not abdominal X-ray but X-ray chest erect view, because it can detect minimal of 1 ml, that is air below the right diaphragm, not left diaphragm. And in abdominal X-ray we will do the left lateral decubitus view, but for that minimum of air should be 2 ml. Now other signs that we see is football sign, regular sign. What is regular sign? That is bowel wall is seen due to air on the both side. Falciform ligament sign, that is silver sign. Doge cap sign, cupula sign, that is continuous diaphragm. Telltale triangle, inverted V sign. So football sign, regular sign, falciform ligament, that is silver sign, Doge cap sign, and cupula sign, that is continuous diaphragm, telltale triangle, and inverted V sign. So inverted V sign is due to umbilical arteries and inferior epigastric arteries. So I am writing this again to remember it in a better way. So we are able to identify various structures in the peritoneal cavity that are generally not visible, but due to excess amount of air these structures are visible somehow. So we are calling a different sign. So first we are seeing is the falciform ligament. That is also known as silver sign. Now what is Doge cap? That is space below the liver and kidney, that is known as the Morrison's pouch, also known as the hepatorenal pouch. If air is present between this space, means in this space, then it is called as Doge cap sign, dependent part of the on supine position, most dependent part. So Doge cap sign, that is Morrison pouch. We can see the air there. Now continuous diaphragm, that is cupula sign. Continuous diaphragm. now what is the treatment? So duodenum ulcer and gastric ulcer, both the treatment difference, but first we have to do the resuscitation followed by laparotomy. So in the duodenum we are going to do Graham's omental patch repair and H. pylori eradication. And here also omental patch repair plus biopsy plus H. pylori eradication, because we know that in gastric ulcer it is more related with malignancy, so we have to take the biopsy and yes, now gastrectomy we can do, that is Billroth 1, and here we can do highly selective vagotomy plus omental patch repair or truncal vagotomy plus antrectomy.